Hi folks, so Mike Karaginas here, Nina Olson, right behind the camera you can't see, Molly Rittberg, all of us from Freedom Physical Therapy here. We just wanted to take a moment to maybe help educate you about how important it is, and overall sleep, right, is important, but airway and your ability to breathe well, particularly through your nose. So we thought it might be nice to share with you how, as physical therapists at Freedom Physical Therapy, we really take this seriously, and there are things that we can do to help educate the patient on maybe the fact that they aren't sleeping as well, maybe they have sleep disordered breathing, maybe they have sleep apnea, and what are some of the markers that we look for in the clinic, and then that allows us to kind of put a little case together and either get it back to your primary physician or an ENT that will help you find in the community that sort of subscribes to this whole concept of the importance of airway and being able to breathe through your nose. So some of the things are questionnaires that we would ask. For example, what's your sleep pattern like? How many hours at night do you sleep? When you are asleep, can you stay asleep? Have you ever been told you snore or that you might gasp in the middle of the night? Do you have restless legs? Do you feel tired at 2 or 3 in the afternoon where you could literally take a nap and fall asleep? And of course, worst case, have you ever just fallen asleep in the car at a stop sign, even if momentarily? Some of these can be indications that your sleep is probably disrupted and not doing well. Same with children. We see a lot of this in kids, right? Environmental allergies, seasonal allergies, pet allergies, any of these things that can compromise your ability to breathe through the nose, and now you become more of a mouth breather. So I don't want to get too technical, right, but just some quick screening things. Just going to cover a couple of them, not all of what we look for, but in addition to a really good questionnaire, some things would be like, for example, just looking at the person visually, right? Like in Nina's case right now, right, her lips are touching. So that gives me some general confidence that probably pretty much so throughout the day, she seems like she can probably breathe through her nose. But something we will typically see in a patient who tends to be more of a mouth breather is, if you just relax your lips a little bit, Nina, right? You might notice that their lips are almost never touching most of the time. Just a casual observation during the evaluation process. Or what you might notice is momentarily she'll touch her lips, but then immediately, right, because she wants to breathe, has to open up her lips so she can breathe through her mouth because maybe there's something going on nasal-wise. She's congested, sick, or this is just long-term. And where this really takes us is it's really the children that we're most fascinated in, right? Because in those early developmental years is when we want kids to develop craniofacially, right? And develop good sleep habits, in general good health and well-being, and hopefully minimize chronic sore throats. If your kid is having chronic sore throats, chronic tonsil issues, adenoid issues, right? Even earache and type of thing, we tend to see this as a pattern. They are probably becoming chronic mouth breathers, and at least in my humble opinion, the sooner you can get on top of that in their early years and understand it and manage it, the better. So the other thing we'll look at would just be, if I have Nina tip her head back gently, we'll kind of look through each nostril a little bit. So for example, sometimes you might notice that, let's say, if I fabricated, her right nostril appears a little bit more narrow than the left side. Maybe that's an indication that she might have a little deviated septum or something structurally, right? Maybe that's going to make me ask the patient, did your knee ever hit your nose? Did you ever get your nose broken? Or is it just part of the growth and development, something that has occurred? Then I'll have them bring their head back to neutral, and then to vet that, right, I could have her hold their nostril on the right side, and then just say, do a very forcible inhalation on the left side, right, and even more forceful. There we go, right, and then I could block the left side and have her do the right side, right, and just get a comparison. First of all, what am I seeing and hearing, but then more importantly, what does she perceive? Like, oh yeah, it is harder for me to breathe through that narrower right side. So that might be one thing. Another very simple test, too, could be at home, and with your children. This is easy to do as well. Have them keep their lips touching at all times. If you are willing, there's also a particular paper tape that you can buy, and you could tape their lips shut. Of course, they're wide awake here. And see if they can breathe through their nose for 3 minutes straight. So it's called the 3-minute test. And that one can be, you might be surprised how difficult it is, even for yourself, to maybe breathe through your nose for 3 minutes without separating your lips. So that can be another great indicator. The other thing we tend to look at just for potential sleep disordered breathing issues could be something we call the thyromental angle. So you might notice from a side profile that it might look as though someone does not have a chin. Or for a lot of men, neck circumference of 17 inches or more could be a potential factor. You know, yes, weight can be a factor, but there are plenty of super fit young men and women that have sleep disordered breathing issues. So it isn't always just about weight. And then the other thing I love to do is we have this thing called a throat scope, which illuminates, and then it allows us to have the patient open their mouth. And then when she opens her mouth, again, without getting too technical, I can take a look inside to see what her airway is like behind her tongue. So I always talk about, you know, there should be two tunnels you can see, and the uvula, I call it the little punching bag, is in the center, right? So just to see how open and patent is it when they open wide and their tongue is down. If you can't see anything back there except the back and base of their tongue, that's kind of high on something we call the Mallampati score, which could be an indication that that person probably does mouth breathe. They probably even snore at night because their tongue is sort of dropping back at night and blocking their airway. It's also an opportunity with our kids, but even adults, to look at the tonsils. You can see the tonsils with this as well. The adenoids you cannot. We'd either have to send you to an ENT where they'll do a scope, or something we love to request is a cone beam scan is a great way to really look at airway and everything. It's a phenomenal tool that we have at our service. Other quick indicators could be something when we look inside the cheek, we would look for something called mucosal ridging. So does someone have a little white ridge that is developed on the inside of one or both sides? And then maybe the other thing would be you would have them stick their tongue out, and you would look to see if they have any indentation of their teeth on their tongue. We call that scalloping of the tongue. And then another potential indicator, aside from those couple factors, would be like we just keep going back to, momentarily kind of just constantly breaking that lip seal could be a possible indication as well. So just wanted to give you a quick overview of just all the things that we look at from a physical therapy perspective, overall health and wellness, right? Because we truly believe sleep is crucial. The better you're sleeping, right, that's our time at night to repair and remodel and wake up feeling refreshed, and keeping our immune system high and all the other good things that come with really good quality sleep. So we hope this helps. If you have any questions, give us a shout out. We would love the opportunity to evaluate you or your children if you have any concerns around this topic. Thank you.